Hello, and welcome to this video where we'll be taking a look at leprosy, a very disabling disease that has a huge impact on individuals and their communities. Leprosy is caused by a type of bacteria called Mycobacterium leprae. A related bacteria called Mycobacterium lepromatosis may also cause leprosy. Leprosy is an ancient disease that has affected humanity for centuries. It's also known as Hansen's disease, named after Dr. Gerhard Hansen, who in 1873 first discovered the bacteria that caused leprosy. In 2015, there were about 200,000 new cases of leprosy around the world. So, how is it transmitted? How leprosy spreads from person to person is not very well understood. It is thought to spread through infectious droplets when a person with leprosy coughs or sneezes and the other person breathes it in. Leprosy isn't easily transmitted, and there needs to be prolonged, close contact with an infectious person for the disease to be spread. Certain species of armadillos are also known to carry the bacteria causing leprosy. Let's have a look at how the disease presents. Because the bacteria grow very slowly, it can take many years for a person to develop the disease once they're infected. The incubation period is on average about 5 years, but can range from a year up to 20 years or more. Leprosy mainly affects the skin and the nerves. There can be discolored patches in the skin. They're usually lighter than the surrounding skin and have no sensation. The affected nerves can become thickened or enlarged and may not work properly. This can lead to weakness in the muscles supplied by the nerve and reduce sensation to the area supplied by the nerve. Nerve damage can also lead to symptoms such as reduced sweating. The loss of sensation can lead to injuries, particularly to areas such as the feet. These can go unnoticed, and people can end up with wounds and ulcers. They could also get worse over time and can lead to deformity and disfigurement. Other areas of the body that can also be affected include the mucous membranes of the upper respiratory tract and the eye, which can sometimes result in blindness. Unfortunately, people with leprosy may experience stigma and discrimination because of the disability and disfigurement that the disease causes. This can have a significant impact on their functioning in the society and their access to diagnosis, treatment, and care. Let's have a look at how the disease is diagnosed. Leprosy can be diagnosed using clinical and laboratory findings. Clinical findings include discolored skin patches with a loss of sensation and thickened nerves. Slit skin smears can be taken by making a small incision on the skin and examining it under the microscope for bacteria. Leprosy can be graded from mild to severe based on clinical findings, results of the skin smears, or a combination of the two. The WHO classification system uses the number of lesions or skin smear results to categorize leprosy into paucibacillary or multibacillary leprosy. The Ridley-Joplin classification system has 5 different categories, from tuberculoid leprosy, which is the mild form, to lepromatous leprosy, where there's widespread disease. The severity of the disease depends on how well a person's immune system responds to and fights these bacteria. So how do we treat the disease? Treatment focuses on using medication to stop the disease, managing the complications of the disease, and preventing disability. Leprosy can be curable with a combination of drugs taken for several months. The type of drugs that are used and the length of time will depend on the type of leprosy the person has. One of the complications of leprosy is the development of reactive episodes as a result of the response of the body's immune system to the disease. These episodes can occur before, during, or after treatment. There are 2 types, type 1 and type 2. Type 1 reactions can cause a range of symptoms such as redness and swelling of the skin patches, pain and tenderness of the nerves. Type 2 reactions can also cause a range of symptoms that include fever, malaise, and a skin rash called erythema nodosum. These reactions can be managed with medication. Preventing disability is an important part of managing leprosy. This involves looking after areas of the body that are numb or weak to prevent injury. This can be through actions such as regular inspection and cleaning of infected areas and wearing appropriate footwear. In some cases, reconstructive surgery may help. The disabilities and deformities that have occurred may or may not be reversible depending on the extent of the damage that's occurred. So how do we prevent the spread of leprosy? Leprosy is not very infectious, and most people have natural immunity to the disease. Therefore, it doesn't spread that easily. Measures to avoid leprosy are not having close contact with people with untreated leprosy, avoiding close contact with armadillos because some of them may carry leprosy. There is no specific vaccine for leprosy. However, the BCG vaccine, which is primarily used to prevent tuberculosis caused by a related bacteria, provides some protection against the disease. Global efforts to control the disease have been led by the World Health Organization, national leprosy programs, and others such as pharmaceutical companies and non-governmental organizations. These have led to a significant decline in cases. The three actions that have been promoted in the Global Leprosy Strategy to reduce leprosy are strengthening government ownership, coordination and partnership, stop leprosy and its complications, and to stop discriminating and promoting inclusion of those affected by the disease. And that's an overview of leprosy. For more information, have a look at the websites below.